Hi, I'm Dr. Harold Kraft with No Needle Epidural and offices in Manhattan Beach and Santa Monica. I'm a pain management physician, and the services I offer are virtually the same as any other pain management physician, except that I no longer use big needle epidurals. I use a laser to get the same effect with a no needle epidural. It's a very high-powered laser, and the mechanism of action is that the body will secrete anti-inflammatories that treats inflammation not only in the nerve root, but in all the soft tissues that are so often damaged.
What are the benefits of a no-needle epidural treatment over a traditional needle injection?
First of all, I'm not opposed to big needle epidurals. I used to do them, and if you need one or your patient needs one, you should definitely get one. The no needle epidural has two main advantages: half the cost and generally better at treating most pain. Big needle epidurals only treat inflammation around the nerve root. And honestly, a lot of accident victims either don't have much nerve root pain or they have soft tissue pain in addition. The laser treats both nerve root inflammation and soft tissue inflammation, which includes muscle, ligament, even bone, which I'll throw into soft tissues because I'm an anesthesiologist. All that pain that accident victims have from whiplash, from being banged around, the laser can treat, and most other modalities like big needle epidurals do nothing for that pain.
How exactly does the no-needle epidural process work?
We identify the area that's inflamed and laser that area. So if it's a disc or nerve root that's the problem, we laser the middle of the back, basically the same area that you would do an injection in. We laser the neck, and most often in car accidents, for instance, if they have a shoulder problem, we laser the actual soft tissues, the rotator cuff, the bony parts of the shoulder. That's where we laser. What we do is we use a very high intensity near infrared laser. Most people don't understand that exactly, so let me explain that. Here with your electromagnetic spectrum. The no needle epidural is extremely safe. This is the visible spectrum. You all recognize the rainbow from red to purple. That visible spectrum fits into this teeny little slot of all the electromagnetic spectrum. And on the right, we have our dangerous rays: ultraviolet, X-rays, gamma rays. You want to stay away from those. Wear your sunblock at night, or in the day, sorry. On the red end, just beyond the red end, is the near infrared spectrum that we use. And we use a very high dose of it that allows us to penetrate into the areas that are inflamed. One of the differences in my technique, and I've given the most laser in the country, about 25 to 30,000 treatments, is that you need a very strong dose at the skin to get the effective dose of the laser into the nerve root area that is inflamed. Most people who use laser do not use a strong enough dose and therefore don't get enough of an effect. A typical series of no needle epidurals is about 12 treatments, which equals about one big needle epidural. Just like in big needle epidurals, everybody's different. So I've had patients get 90-100% pain relief in as little as 1 or 2 no needle epidurals, or as many as 20. The recovery and improvement statistics are very similar for no needle and big needle epidurals, even though they're very different animals. They both work in about 60% of patients. The fact that you have a patient or a client who has failed a big needle epidural does not predict whether they will have success or failure with a no needle epidural. So you can either send us your clients immediately upon going through a standard set of conservative treatment with PT or chiro, or you can wait till they've had an epidural, and if it works, that's great. If it doesn't work, send them to us.
When would you recommend someone receive a no-needle epidural session?
The first time is that if you have a very low dollar case where you have to get the client treated and they might need an epidural, but it's just too expensive, we can tailor our treatment to meet virtually any budget, including small budgets, and the patient can still get an extremely significant or significant pain relief. So low budgets will fit us. Number two, if the patient, we're in Southern California, if the patient says, "Dear attorney, I really don't want that big needle inside of me, I don't want those drugs inside of me," Whatever their excuse is, a no needle epidural is painless. Most patients love getting it, and we can be a perfect fit for people who need to get treated. They need to get out of pain. You need to document that you've gotten them better. That's a perfect fit. The third case is if you have a patient who's had an epidural or epidurals or injections. We even often treat patients with who are post-surgical. And for those patients who haven't gotten the pain relief that they need, the no needle epidural can often be very effective. The majority of my practice is Medicare and PPO patients, most of whom have failed epidurals and back surgery.
How do you help patients who have recently been in car accidents?
Well, the first thing I do is to reassure them that most of the time the pain will get better, and our goal is to get their pain back as close as possible to zero with full activity. The second thing I do is that I reassure them that I can understand their pain. I'm old enough to have had most people's pains. I've had all kinds of pains. I'm much more in touch with pain than I was when I was treating pain as an anesthesiologist at epidurals in my younger days. The third thing we do is actually treat the pain with a series of high-dose, no-needle epidurals. And that no-needle epidural will reduce the inflammation of whether it's the nerve root or the soft tissues.
How many sessions does it take to begin seeing results?
So the one downside of no-needle epidurals is that it's not a linear progression. The most common person needs 4 to 6 treatments before they experience any results. About 20% of my patients, and its genetic response, will experience tremendous pain relief after 1, 2, or 3 treatments. And I'll let somebody go typically up to 12 treatments before giving up without any response, flatline, because I do have late responders.
Is there anything else we didn't cover that you would like to mention about the process?
Summary of no needle epidurals is that it's half the cost of a big needle epidural. It's probably better for most people who have a combination of nerve root and soft tissue pain or just soft tissue pain. And it can be extremely effective, and it takes typically up to 12 treatments. The other place where no needle epidurals can be used, which has nothing to do with pain, and this is off-label, so you have to be very careful if you're using it in your clients, is that it can be a phenomenal, unbelievably great treatment for PTSD and traumatic brain injury. If you're interested in this, please call me to discuss whether or not your patient is a candidate.
How can someone make an appointment for a no-needle epidural with your office?
The simplest way is to go to the doctorsonliens.com portal, or you can call us directly at 818-855-5950, or you can go to your web browser and type in No Needle Epidural, and our results should bubble right up to the top.